UBC, inspiring Uganda.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Good evening to you, our beloved viewers. You're very welcome to yet another episode of the DOCtalk show. We are always here every Thursday at 9 p.m. talking about real health solutions to real health problems. Today we have a very interesting topic that we are going to talk about. This is a topic that sparked very important conversations a few weeks ago following a social media post, and I believe that we all can guess what topic it is now. So today we're going to talk about fibroids. This is a condition that affects women, and everyone that has a uterus is a candidate of this. So that is already one of the risk factors. With me in studio, I have Dr. Kamala and Dr. Rogers, who have spared time to come and discuss this important issue with you. This show is proudly sponsored by Ministry of Health of Uganda and Kamala Men's Collection. So I'm going to give a second or two for our guests to introduce themselves, starting with Dr. Rogers.
Thank you very much, Dr. Esther. Yes, good evening, our beloved viewers. My name is Dr. Rogers Ssenyonjo, and I'm always glad to be here to share with the public the medical knowledge, the information to the solutions to the real health problems. Thank you.
Hello, our viewers. I'm Dr. Kamala, and I'm very happy to be back on the DOCtalk show.
Thank you very much for that brief introduction. So, what are fibroids? Fibroids are basically growths or muscular growths that happen in the uterus. So I guess today I'm going to expound more about this. Dr. Rogers, could you please tell our viewers how common this condition is and which people are at high risk to get this condition?
Thank you very much, Dr. Esther. Dr. Esther, I work in a reproductive health setting, and I should say one of the most common conditions that women present with are fibroids. So that should just speak to the fact that they are very common. And any woman who is in their reproductive age, that means any woman who is menstruating is at a risk of having fibroids. Okay? Statistically speaking, about 20% of women, by the time they reach 30 years of age, they've actually had or they have fibroids. And like you said, fibroids, basically these are solid masses that are within the uterus. Okay? And however, the risk increases when someone goes to an advanced age. So the risk is higher in women who are between 35 to 45 years of age. And surprisingly, I don't know how God made this or how nature sometimes acts, but race contributes so much, because you find that in the black women, the rate is 2 times higher or 2 to 3 times higher than in actually the white women. So they're actually very common, and trust me, when you visit any gynecological clinic, you find that most of the women present with fibroids. So that's about the prevalence.
Dr. Kamala, do you have anything to add?
Yes. So like he said that fibroids, who gets fibroids, which women get fibroids, as is mentioned, that they're more common as the age increases, as a woman progresses in age above 35 years. And this is because this particular tumor, fibroids, has been linked to the hormone estrogen. So prolonged exposure to estrogen is being linked to these fibroids. So that's why we can assume that as when a woman is, say, 20, she's just been exposed to estrogen for maybe 6-7 years. So the more and more you're exposed to estrogen, because all women produce estrogen. Yeah. So by the time you're 35, 40, you've been exposed to estrogen for so long. So that is one of the things that's associated with this tumor called fibroids. So that's why you find that in women who are maybe like 40, you will find many more have fibroids. However, you have to understand that fibroids progress. They start very small. So you find that maybe like at 25, someone has very small fibroids, like maybe one fibroid in their uterus, but it's maybe just 1 centimeter. So they'll be asymptomatic. They won't be showing symptoms. They won't feel pain. They won't be bleeding irregularly. They won't have fertility issues. But then it increases in size gradually over time, over the years.
Actually, doctor, on that
So
very
that
point,
by the time you're 40, that's when it's reaching a size where now the symptoms are overt. The symptoms now become very evident.
yes, on that very point, about 50% they're actually asymptomatic. So they are found maybe on a routine ultrasound. Someone does not have any symptoms. For someone to get noticeable symptoms, sometimes it takes a minimum of about 3 years as these fibroids are growing. Yes, but also talking about, she asked about what could be risk factors. A number of people ask me what causes fibroids, and I should put it clear that there is no specific identifiable cause that you can say this is what causes fibroids. However, we have some theories or hypotheses. We assume that, or we believe, not assume, but we believe that there is some abnormality. I won't go into the science, but in the makeup of the genes, for example, there are some mutations that take place, and someone ends up developing these tumors. However, among the risk factors that could be there, we have things like people who start their periods at an early age.
Yes,
Exactly.
yes.
Okay, we call it early menarche.
Yes, and that brings us back to the estrogen
Estrogen
because
exposure,
at
yes.
menarche, that's when your exposure to estrogen begins.
Yes.
That's why they say that early menarche will increase your chances maybe of getting fibroids.
True.
Yes, and the about African women, about them being more common in Black women, there is no exact link that has been discovered, no exact gene. So right now, the theory is that this is linked to other determinants of health, access to health care and things like that. Because most of this research, has been done in a more developed countries where they are assuming that maybe the Black women have maybe poorer, maybe access to health care and all that. But there is no real, as to the question as why are Black women more affected by fibroids than other races of women, the answer is not yet so clear. There are still lots of theories.
So about the age issue, would a 9-year-old girl get fibroids?
The truth is, we can never say never in medicine because science is very funny.
Yeah.
However, it is very, very rare. Usually, these fibroids start coming in when someone has started being exposed to too much estrogen, and some of these changes start taking place when someone is in their reproductive age. Okay, and this reproductive age starts when someone starts their periods. So unless if you say, because we've seen there are some cases that we've seen whereby people start their periods too early,
Yes.
but still it is very rare that you find a 9-year-old having fibroids. Okay, yes, but we can never say never in medicine. One of the what caused that discussion you're talking about, I think the topic was about delayed conception.
Yes.
Yes, so delayed conception has been linked with fibroids. Okay, and Dr. Kamala will explain to us about that delayed conception and exposure to estrogen, like she was saying. But women who actually tend to delay to conceive tend to have a higher risk than those who conceive a bit early. However, this is not the cause. I need to be very clear on that. So just because someone has made 30 years without conceiving doesn't mean they are going to get fibroids. It just increases the risk slightly. And there are other risk factors, of course. Women who are a little bit of having too much weight, if I should put it that way, but what obesity? Yes, obesity. Obesity increases the risk for fibroids. These fats, there is a way the body can convert them into the estrogen hormone, and this actually can lead to an increase in the risk of the fibroids. Women who take alcohol, you're actually at a risk of developing these fibroids. Now, something that is very important is family history. So if in your family you have a relative who has had fibroids, especially what we call first-degree relatives, you're actually at a very high risk of developing fibroids. So literally from what we are saying, you can see that almost everyone is at a risk of developing fibroids. Yeah, so you need to just be cautious as a person and as an individual and do routine checkups, as we shall see as we move on.
Yes, for delayed conception or what we call nulliparity, if a woman has not had any children at all, she's like 40 and she's never had any children, So that's also associated with an increased risk of fibroids. And it goes back to the hormone called estrogen. So anything we've seen, estrogen is linked to these fibroids. So anything that exposes you to a lot of estrogen. So the women who don't have children, they don't get those periods of pregnancy where they have progesterone coming in to balance out the estrogen. So they have all these periods, all these years where they've had so much estrogen exposure. So that's why nulliparity or not having children is also linked to fibroids. And then the same explanation for delay to go into menopause. Yes. So also late onset of menopause for the very same reason. So this is a hormonal tumor. It is linked to a hormone.
Dr. Kamala, what is menopause?
So menopause is a period in a woman's life when her reproductive hormones change and ovulation gradually stops and menstrual periods also gradually stop. So this period normally happens between the ages of 45 to 55 in most women. So during that time, it's a gradual process. It's not an abrupt stop. It's a gradual process, and change in ovulation. Ovulation gradually decreases and then stops, and the menstrual periods also gradually change, decrease, and then they stop. And all this, of course, is governed by the hormones, the hormonal changes that are taking place.
So, Dr. Kamala, we are now going to take a short break. We are still talking about fibroids. Please stay tuned.
This message is from the Ministry of Health with support from partners.
Since
Mommy, Daddy, Uncle, Auntie, Tata. I am healthy. I have a dose of the I wanna live long. Give me the jab. Give me protection. Give me the dose. Health is strong. Give me the jab. Give me protection. Give me the dose. Playing. I am growing. I am healthy. I have a dose of the
parents and caregivers, remember to immunize your children 9 times from birth to 18 months to protect them against vaccine-preventable diseases such as measles, rubella, polio, pneumonia, hepatitis B, tuberculosis, tetanus, meningitis, yellow fever, diarrhea, whooping cough, diphtheria, and malaria. All vaccines used for immunization are safe, effective, and free. This message is from the Ministry of Health with support from UNICEF, WHO, and partners.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Welcome back from the short break. You are still watching the DOCtalk Show, and we are talking about fibroids. Now, what we need to know is that we have spoken about the risk factors, but one of the constant risk factors is the fact that you are female. You have that uterus where actually these fibroids grow. So please note that every woman has at least a chance at one point, in addition to the other risk factors that have been mentioned. So right now, we are going to dive into the different signs and symptoms. How does one know that they actually have these fibroids? So Dr. Kamala, please take us through how one can know that they actually have fibroids.
So fibroids, as we've seen, this is a tumor that's growing within the uterus. So the signs and symptoms are going to depend on where it's growing and how big the fibroid is. So let me take you into a little bit of anatomy. So the uterus has a lining called a mucosa. And then underneath that lining, that lining contains blood vessels. And underneath that lining, we have a muscular layer. And then we have another layer covering the muscle. So depending on where the fibroid is, the fibroid might be in the muscular layer. It might be right underneath the mucosa, or it can be on the other side of the muscular layer protruding outwards. It can be at the opening of the uterus, the cervix. It can be at the top. So depending on where the fibroid is. But because this is a swelling within the uterus, it's going to press on the surrounding structures. So if the fibroid has grown, the first thing a woman may notice might be some pelvic pain. It might be some pain on urination, passing urine, because the bladder is right next to the uterus. A woman may feel pain during sexual intercourse because once again, the fibroid might be located right near the cervix. So depending on how big the fibroid is. Then also, we have to look at the bleeding aspect. So the ones that bleed the most and the worst are those that are found right under the mucosa layer, the inner line, the most inner lining of the uterus. The ones that are found right underneath there, they cause heavy bleeding. So the symptoms that a woman may face, may realize that maybe her periods are getting longer, they're getting much heavier, and that is a common sign of fibroids. So now this, remember that to put this in context, all these things are gradual. So as the fibroid starts, when it's just 2 centimeters or 1 centimeter, there may be no symptoms. Then as it grows and grows, the symptoms progress. A period that was 4 days becomes 6 days. And then blood, a heavy, light flow becomes a medium flow, then becomes a heavy flow. So that is how fibroids present. That's how a person realizes that maybe they have fibroids. Then also, another common way people discover they have fibroids is fertility. So someone may have been unaware that they have fibroids, and then let's say, for example, the fibroid was right near fallopian tube, and then it affects their ability to conceive. And in that process of trying to find out the cause of the person's failure to conceive, then the fibroid is discovered. So also failure to conceive is another symptom that can bring fibroids. Yes.
So what we need to know is that, like she said, sometimes you may actually have the fibroids, but you may not be aware. Something that we medically say that the patient is asymptomatic. So you may have it and you don't know, and maybe it's discovered during the other normal basic routine checkups. However, Dr. Kamala still mentioned a point about fertility. Dr. Rogers, could you please expound more about what exactly happens? How do the fibroids actually affect someone's fertility?
Okay, thank you very much, Dr. Esther. One of the challenges that people with fibroids come with is actually fertility, like Dr. Kamala said. And it can be very challenging to manage. Sometimes it might necessitate going into surgical operations, among others. And just how it happens, still it comes back to the anatomy that she was talking about. The site, that's the location of the fibroids, matter so much, and the size of the fibroids. So for example, if the fibroids are located, let me say at the cervix, okay, these fibroids are going to interfere starting from right the sperm entry, how the sperms are entering, the sperm movement, how they swim through the cervix to enter the uterus, you know. Still, even when they are within the uterus, still they affect the sperm motility. So one of the ways fibroids actually affect is by affecting how effective the sperms are in reaching the egg. That's one. And then two, these fibroids can also be located near the tubes, like she has said. In case that happens, they actually have that pressure effect. They compress the tubes and obstruct them. So in that way, it still is going to cause an issue on sperms meeting with the eggs. That means the sperms won't be able to meet with the eggs for fertilization, and definitely no conception.
Yes.
Then another way is on the endometrium, what she was calling the mucosal layer. That's where the placenta implants after fertilization takes place. So what actually happens is that these fibroids can disrupt this layer, this endometrium. And definitely once that happens, they're going to have issues with implantation. It won't be able to take place. These fibroids, they cause this layer to become congested, that mucosal layer to become thick and edematous, like it has a lot of water in it. Because one, they interrupt the blood flow to that layer. So once that happens, it is flowing back becomes hard, and then that layer becomes edematous, thick, and not conducive for implantation to take place. This means even if fertilization takes place, still we shall not have implantation taking place. And we've seen some ladies who actually get a little bit of implantation, and it comes out maybe within that very cycle. So they don't even realize they were pregnant just because they got that early miscarriage. And this also happens just because of that disruption around the mucosal layer. But also, one last thing is if the fibroid is too big, still it is going to eat up the space, especially the submucosal fibroid she was talking about, also the intramural. Those are the ones which are within the muscle layer of the uterus. Especially when they are too big, it's going to eat up the space where these processes would have taken place, implantation and everything. Okay. By the way, fibroids can be they can become very big to an extent that a woman appears pregnant. Okay. And most women come when they have not had all other symptoms. That's how surprising science can be. They come when they're now, they're seeing their abdomen is bulging, it's increasing. So they can go to that size of looking like someone is pregnant and they're carrying a baby. And definitely this will affect the fertility, definitely. Yeah, so that's how, those are some of the processes in which these fibroids affect someone's fertility.
So there's another symptom we haven't talked about. So because there is bleeding or some irregular bleeding sometimes or excessive bleeding, we also have symptoms that can come as a result of that. So you can get symptoms as a result of anemia, that is chronic loss of blood, or if you keep losing blood over a long period of time, then your blood, your iron stores get depleted. And then someone may also get fatigue, dizziness, and so they may also come with those symptoms.
So about the fertility let me take you a little back to the fertility bit. Does it mean that if I have fibroids, I can't get pregnant?
No, that's not true. Actually, there are two things I want to talk about, and you guys with that question. One, giving birth does not eliminate the risk of getting fibroids. Some ladies think just because I've given birth, let me say I'm 22 years old, I've given birth, then the risk for fibroids is eliminated. That is not true. But also having fibroids does not mean that you will not conceive. However, it depends, like I said, on the location of the fibroid, the size of the fibroid, and the number. In some ladies, you might find they have what we call multiple fibroids, like there are very many of different sizes. So this might actually affect the entire process of fertility. Also, we've seen in some cases women who have fibroids actually struggling with ovulation. They do not actually ovulate at all. So these fibroids can also affect the ovaries where the egg is supposed to come from. However, you can still conceive with a fibroid and you actually carry the pregnancy to term.
Okay. Thank you very much, doctors, for this very interesting conversation. I believe that our viewers, they are actually picking some points. I'm just hoping that we're actually trying to debunk some myths that you people could be having, knowing that if I get a child or if I get pregnant, that means that I'll never have fibroids. No, you can actually, like we've said, there are different risk factors, and you could be having another risk factor, not just that you've got pregnant. So please stay tuned. We are going now for a short break. It's still the DOCtalk show.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Hello, Kampala, Uganda. In response to the national call of strengthening the traffic security, Good Products Group HGO brand has officially launched the rider selection campaign. Registration is now open. Visit www.riders.hgo.com. Complete your registration now for a chance to win exciting prizes including motorcycles, exclusive HGO gift boxes, and official rider vests, all while promoting safe riding awareness. This is how to participate. Pay the registration fee, invite 3 friends to form a team of 4, and your registration fee will instantly be refunded. Begin your journey of honor today. Don't miss this opportunity. Join the challenge, promote road safety, and become a pioneer rider. For details, visit the official Good Products website at www.hgo.com or call toll free 0800-335-555 or visit our offices at Kingdom Kampala 3rd floor to register now and win prizes worth millions.
You are watching the DOCtalk show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short break. You're still watching the DOCtalk show. We are talking about fibroids, a very important topic. Thank you so much for being here and not leaving the show. And this show is proudly sponsored by Ministry of Health Uganda and Kamala Men's Collection. For any inquiries, reach out on the numbers below the screen. And if you have any comments or anything you want us to improve, feel free to reach out on the numbers on the screen. Additionally, do not forget to follow us on all the social media platforms, that is on X, Twitter, and please subscribe on our YouTube channel too. So now we are going to dive right into how we can diagnose these fibroids, because when you go to the hospital, what would you expect our doctors to do? So they're going to tell us briefly what happens and how we diagnose these fibroids. Dr. Rogers.
Thank you, Dr. Esther. Now, fibroids are very easy to diagnose, if I should say. However, the challenge comes in with the aspect of asymptomatic kind of aspect. In that most women whom we diagnose with fibroids are actually women who come, maybe someone is having pain, maybe from a PID, and then you do a scan and you find, oh, you actually have a fibroid. That's the first one. But basically, when you come to us, of course, we shall look at the symptoms why you've come to us, to the hospital. We shall take some bit of history to understand your condition from you. We shall examine, the doctor might need to examine you. Most women, for example, let me give a picture of who a woman with fibroids, how they present. So this is a woman who is in their reproductive age, and most of them 35 years and above, presents with abdominal pain, no abdominal pain. Sometimes they report back pain, yes. Pain radius to the thighs or to the pelvic region, okay? And they also report changes in their bleeding patterns. So someone maybe is having, like Dr. Kamala said, prolonged bleeding, heavy bleeding, or painful bleeding. So that's how most of them present. And the one important thing is perhaps they're also having a little bit of infertility. So to me, when a client comes and they have that kind of picture, I would actually think about fibroids instantly. And of course, I'll go ahead to examine this person. Most of them, because they bleed too much, you might find they actually have anemic. They have lost too much blood here and there. Fibroids cause hemorrhage, both external and internal. That's bleeding. They can actually have bleeding within the capsule, within the fibroid itself, without blood coming out physically or externally. But when you examine them generally, they might be a little bit anemic. They are pale. And then you might need to do an abdominal exam. Okay. So you might find there is some bit of swelling when you try to press on their abdomen, as if they are pregnant, but the pregnancy is still young. Okay. Usually we start palpating or we start feeling the fibroids when they're about 12 weeks. Those who have been pregnant before, they know what I mean by 12 weeks. Yes, those are around 3 months. Yeah, they know, the mothers. Yeah, so we start feeling the fibroids. Okay. And definitely we shall need to dive into now investigations. And one of the most commonly available, and we can even depend on it to make a diagnosis, is the ultrasound scan. So we shall do an ultrasound scan to visualize your pelvic organs, look at the uterus, and see if there is anything. But the one that we recommend the most is the transvaginal ultrasound scan, because it is a bit more accurate and highly sensitive, especially in assessing the size and the location of the fibroid. However, it's also somehow expensive, so some people cannot afford it and they go for the transabdominal pelvic ultrasound scan. That is also okay. It can still give us the results we need. There are also a little bit of other diagnostic modalities which are not so common. That's the most common one. But in some facilities where they have the capacity, they can do things like HSG. You know that HSG we do for fertility. We can actually do it as well, and we can be able to have some diagnosis in regards to fibroids. We can also do laparoscopy, okay? And the beauty with this is it can even be done if the fibroid is small, can even resect it out immediately.
Yes, okay.
There are others like MRI. These are now more advanced and sophisticated kind of equipment, but of course they are more accurate, okay? But they can also be used in the diagnosis. There are no much lab tests that you need to do, and most of them that we do are just supportive. For example, a complete blood count, where you found someone is maybe a bit anemic, so you want to know their blood levels, you might need to do that. In some facilities, they might ask for things like hormonal profile, but its value might not be might not change much in the management. Okay, but of course it gives a picture of what's happening, and you might most times we find that the estrogen is actually very high in people with fibroids when we do the hormonal profile. Yes, but basically it's more of an interaction with the client and doing those basic ultrasounds, image scan, or those imaging tests. We can be able to diagnose the fibroids.
Thank you so much, Dr. Rogers, for that input. Now, to Dr. Kamara. If a woman is pregnant and they have fibroids as well, does this mean that they'll actually, it's automatic for them, they must deliver by C-section, or some can actually deliver normally, whereby they just push the baby?
So if a woman has fibroids, does this mean that she's going to deliver by C-section? So the short answer to this is no. So having fibroids doesn't mean that you will, as a must, deliver by C-section. However, there are certain things that will be more frequently occurring when you have fibroids that might lead you to have a C-section. For example, it's been found that when a lady has fibroids and she gets pregnant, the chances that she will have maybe an abnormal presentation. By presentation, we mean the way that the fetus or the baby is positioned in the uterus. So there's a normal position that is conducive for a normal vaginal delivery, which is head down. But when you have a fibroid, it will might affect that positioning. So instead of the head down, you have the head on the side or the head up. So that may happen and maybe lead you to have a C-section because of that. Then also there's the positioning of the placenta. So normally the placenta is located at a certain point in the uterus, at the best point for it. But now when you have a fibroid, it may also affect where the placenta implants. So you may have it in the wrong in a wrong place, and that maybe we call it placenta previa, and that predisposes you to bleeding, and then you end up having a C-section because of that. Then there's also something we call placenta abruptio. That is the placenta before its time, it detaches from the uterine wall. So that happening has also been noted maybe more frequently in people with fibroids. So you can have placenta abruptio, the placenta detaches at the wrong time, and the placenta we know is what feeds the baby, the fetus. So when it detaches, then blood supply and oxygen supply to the fetus reduces, and then because of that, because of the fetus's health now being at risk, life being at risk, then you have a C-section because of that. So this is what happens when you have fibroids and you get pregnant. It's not a must that you have a C-section, but it's just that so many things can happen because of that fibroid, and you end up with a C-section. But otherwise, you can have a pregnancy with a fibroid and you still deliver normally. If let's say it is small inside and it does not affect the position of the fetus, it does not affect placenta location, it does not affect it doesn't affect the whole delivery process, then you can still have a fibroid and deliver vaginally.
Actually, Dr. Esther, just a brief one to add on that. A woman with a fibroid is kind of a high-risk pregnancy. Most of these fibroids will be identified during antenatal. So if a woman is attending antenatal, of course they do those routine ultrasound scans that we do during antenatal, and we can identify them. So we advise, like Dr. Kamala said, you can deliver vaginally, but we advise you to deliver from a facility that is well equipped, so that in case of any complication that could come in as a result of this fibroid, you can easily be attended to, and you have a safer delivery than a vaginal one. Exactly. Okay. And also, just to add on what she has said, there are some fibroids which are located at the cervix. We call them cervical fibroids. Okay, that's their positioning or their location. Okay, these ones can actually block the birth canal, so you might not be able to push on them. Yes. Okay, so that one might actually make it an elective C-section. Okay. Yeah, so you need to be very careful not to just deliver from anywhere and be in a facility that is well equipped to handle you in case of a complication.
Yes, so all in all, if you do have fibroids conceived, that pregnancy has got to be managed antenatally, and delivery-wise, you've got to be managed in a good health facility.
Exactly.
How about mothers that have had fibroids and they have been removed before, but they have not they have been removed before and they've got a chance to actually carry their pregnancies. What advice do you have? What can you say about that? Can they also?
Thank you very much, Dr. Esther, for that question. Now, if you are a lady who has actually had a surgical procedure to remove fibroids, this automatically puts you on the list of the risky pregnancies. Okay, because one, these procedures involve cutting the uterus to remove the fibroid, and this weakens that muscle layer. So just like a woman who has had a cesarean section before, okay, these people are actually at a risk of having another cesarean section in case of any complication. So the same applies with people who have had a myomectomy, because the risk for rupture is high because of this procedure that they underwent. So we also recommend them to be managed right from antenatal in a facility that is well equipped and still deliver from a well equipped facility. You can push, but in case of a complication or where we suspect maybe possibility of a rupture, we can easily have a safer option.
Yeah, thank you so much, doctors, for the great submissions. I believe that our audience is actually learning a thing or two. Do not forget that our program is sponsored by Ministry of Health Uganda and Kamala and Men's Collection. We are now going to take another short break. Please stay tuned.
You are watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Crafted with precision, designed for brilliance, Supreme Wave pens reach the hands that shape tomorrow. Only a Supreme Wave delivers expression this pure. In every stroke, confidence flows. Because greatness isn't guessed, it's written. Supreme Wave, write your future.
It's a FlexiPay cashback explosion. Shop and pay with your FlexiPay. Cashback instant. It's a FlexiPay cashback explosion.
It's a FlexiPay cashback explosion. Simply shop and pay with your FlexiPay at activating outlets and enjoy instant cashbacks. Terms and conditions apply. Stanbic Bank is regulated by the Bank of Uganda and customer deposits are protected by the Deposit Protection Fund up to 10 million Uganda shillings.
Watching the DOCtalk Show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short break. You're still watching the DOCtalk Show. We are glad you're still here with us. The topic is still fibroids, and like I earlier said, every woman, for the fact that you have a uterus, you are a potential candidate. We are now going to talk about the different treatment options that we have, because we believe that some of the fibroids can become really bad and can give you very bad symptoms, like our doctors had told us about. So what are the different available treatment options? And is it that everyone with a fibroid actually needs to undergo surgery or actually needs treatment? Dr. Kamala, over to you.
So the treatment of fibroids, it depends. So if the fibroids are asymptomatic, that is, there are no symptoms, they may go without treatment. So when a woman comes to the hospital with fibroids, several things are considered in the treatment. So they consider the woman's age, the size and location of the fibroids, and the desire to either maintain fertility or improve fertility. So that's what's considered. And the treatment options are very many. It also depends on the symptoms the woman comes with. As we had seen before, there are lots of symptoms. Someone may come with anemia, another one may not have anemia. Someone may have abnormally long periods, another one may have normal periods. So the treatment is going to be based on that. All that is going to be considered in the treatment. Yes, so Rogers will go more into the treatment options.
Okay, thank you, Dr. Kamala. Talking about the treatment, like you've said, we consider all those factors. They are symptomatic, like you've said, we call it watchful waiting. There's some clients that come, you find someone is having fibroids, but they are small in size, maybe like 1 centimeters, 2 centimeters, and all you have to do is to, just counsel them. There are no symptoms, and you do a routine review or checkups. So if you, yes, exactly. If you come and we see that you have fibroids, but they are small, no symptoms, we shall be like, you know what? Let's just monitor you. In case they actually increase in size, or in case they bring in symptoms, now we might need to consider our management options apart from the watchful waiting or the expectant management. Okay. Now, for someone who has fibroids that are symptomatic, still we're going to look at like she said, the other factors. There are options. We have the medical management and the surgical management. Okay. However, I need to stress out something, that the medical management does not, most times, does not eliminate the fibroids. Okay. Actually, we use it mostly as a supportive kind of treatment, whereby the definitive management for a fibroid is surgery. But still, we should put into consideration, is someone still interested in children? What is the size and the number of these fibroids? Because even in surgery, we can either operate to remove the fibroid, or we can operate to remove the uterus, especially if the effects are quite life-threatening. Okay, but talking about the medical treatment, why would we give you medical treatment? One, for women who come in and maybe is bleeding too much, so we want to give them some medical management, basically to control the bleeding. Then you have some options that shrink or reduce on the size of the fibroid. However, they do not eliminate the fibroid, like I said. And most times, once we stop them, this fibroid can recur and can grow again. So most times we give this treatment when we are preparing someone for surgery. Okay, so maybe they have a big fibroid, you want to first reduce on each size, and then you go in for surgery. So you can give the medical treatment. Also, sometimes we give the medical treatment still in preparation for surgery. Let me say someone is anemic. So someone who is anemic, you can take them for surgery, okay? Because they are at a risk of many complications. So you want to first stabilize them. So this medical management is still to stabilize someone. And then there are some people who might not be suitable for surgery. Okay, those category. Maybe someone is having some condition that might not allow them to undergo surgery at that point. So we might still give them medical management as a palliation, but still the definitive will be surgery. Now, when it comes to surgery, what basically is done is okay. When do we do surgery? Maybe start from there. So we still will look at the size of the fibroid. So we say fibroid is big when it is above 6 centimeters. Okay, it is actually a big fibroid. At 6, we might not do surgery as such, especially when you look at the symptoms and they're not so, disturbing, but it's a big fibroid. But there's some people you find and the fibroid has actually become very big. I told you earlier on, some women can have like as if they're pregnant. So definitely they will need surgery, okay? And then the reproductive needs. If someone still needs to have children, you're going to need to reserve this uterus. So you will operate them to remove the fibroid while reserving the essential parts of the uterus. And then in case someone has had maybe the desired number of children, or that surgery to remove the fibroids is not enough, we might need to remove the entire uterus to save their life, okay? And this can be done, of course, it can be total hysterectomy, where we remove everything, including the ovaries, or sometimes we can just do a subtotal, where we just remove the uterus alone and reserve the other organs, okay? But basically, that's the management that we have for fibroids.
So I had a question. Can these fibroids, if let's say a patient has had C-section, can you also equally remove their fibroids, maybe as you remove their baby? Can it be done?
Okay, now we discourage conducting surgery to remove fibroids during delivery, especially C-section, okay? There are some exceptions. For example, if someone is having what we call a subserosal fibroid, that's a fibroid that is outside the uterus, okay? It is detached. It just has just a small thing that is attaching it to the uterus, but it's outside the uterus. That fibroid can easily be removed because you can easily control the bleeding. However, if the fibroid is maybe in the muscle or inside in the mucosal layer that we are talking about, that fibroid poses a very high risk of bleeding if you tamper with it. So what we encourage is do what has taken you there, remove the baby, let the mother go back, heal, and then you can arrange another surgery to remove the fibroid. Yes, sometimes patients be like, hey, doctor, I have a fibroid. Can you also remove it during the section? Please, we always don't tamper with it because the risk of bleeding to death is very high.
And additionally, for that, if a doctor actually is going to remove that fibroid, it means it's kind of like also another surgical procedure. So the patient has to actually also consent that, yes, remove the baby. Okay, also after removing the baby, please remove the fibroid as well, like you must sign. So if your doctor has actually found it maybe also incidentally during like removing of the baby and has not removed the fibroid, it means that also maybe you had actually not consented. You had not allowed the doctor, because that also puts us to other legal issues if someone does that procedure without doing what? Without getting consent from the patient. So my other question is, can these fibroids actually come back once they've been removed?
Yes, recurrence is possible.